Welcome everyone to our discussion as we can continue to explore the impact of the COVID-19 response on our efforts to eliminate hepatitis. It's great to have all of my colleagues together to discuss this, and we look forward to your questions in the Q&A icon that you can open and ask those. Let me start off with Shivanti, who's done who is a hepatologist, but also does a lot of work with field epidemiology and modeling to inform policy development in low and middle income countries, and has been doing some work in modeling of the COVID-19 epidemic response on vaccination coverage. And I thought we'd just turn it over to Shivanti to give us some highlights of what that modeling is showing us. Shivanti?
Thanks, John. Thanks for a great presentation. So yeah, I mean, I think that we're in a sort of, as we know, unprecedented times, and you know, we know some of the impacts, but not the whole sort of future impact. So some work we did was looking at the theoretical impact of disruptions to immunization, which we know can be infected, both infant vaccination for hepatitis B, but also birth dose. And we compared it to the aspirational plan scale up that WHO are doing. And this was for World Hepatitis Day. And what we saw really with some theoretical drops, maybe 20% of infant vaccination and 60% in birth dose, because we think maybe birth dose coverage is a bit more vulnerable and fragile. If that's done for 1 year, it's the birth cohort of 2020, which really is affected. Then we looked at what if that drops for 2020, but then we scale up again. So there's a delayed expansion of 2 years. And there we see a detrimental impact. And this is different across different regions. And really we see the Afro region is disproportionately affected because overall the coverage is lower. So if we compare it to the aspirational scale up, this is quite significant. Then we looked at what if we drop the coverage, delay the expansion, and then scale up more slowly. And really we see here that worryingly, the WHO targets on a global level won't be reached before 2040. So I think this is, you know, it's theoretical. We don't know if the 20 and the 60% are really what we're going to see, and it's going to be very different across different countries, even within countries. So we really need the data like you're all collecting to see how this pans out. But what we're seeing really is the short-term disruptions are going to have a lasting impact on preventable new infections and deaths.
Yeah, very troubling. It's really a call to action. It just really shows you the importance of vaccination and the importance of getting the vaccination coverage back up as quickly as possible. I'm going to turn it over to Carrie James from the World Hepatitis Alliance, who is the executive director there. And they have done a survey of some of the consequences of the COVID-19 response, you know, across different providers, but particularly looking at civil society organizations. And I thought Carrie could give us some of the highlights of that survey. Carrie, welcome.
Absolutely, thanks, John. And let me just say it's an honor to be in this session and, you know, to hear all the amazing work that Arafat is doing with that community organization in Uganda. I mean, it's such a master class in how community organizations adapt to crisis situations and find ways to really serve their communities. And as John said, we conducted a survey which we started at the end of March, mostly for our members, but it ended up being taken up by many more people around the world, and including 9 members from 9 countries in Africa. And some of the results form the basis of a comment piece in the Lancet GastroHep that came out around World Hepatitis Day, so you can check it out there. But what we found was very similar to what John described earlier in health systems. You know, it definitely, most people, if not all organizations, said that they were affected. It definitely had a big impact on access to treatment. And it's interesting when you looked at the reasons why people weren't accessing treatment. I mean, we'd had about 20% of the responses in Africa said that it was because of drug shortages and stockouts. The two most popular reasons was one, because services were being reallocated, were closed because of COVID. But equally important was the fact that people were avoiding healthcare facilities because of fear of COVID. And I think that's something really important to think about going forward, because even if we see cases and infection rates of COVID decreasing, this fear of healthcare facilities may not decrease. So it's really it can really be the role of civil society organizations to deliver a wider range of healthcare services in settings that people trust. Also, in terms of testing, most people said that their testing was either completely stopped or was interrupted in their country. And I think the one thing that really came through when we looked behind the data was this kind of resilience that civil society was showing, this kind of desire and passion to find a way to overcome these obstacles. So whether that's like Arafat was describing, taking out motorcycles and delivering treatment to people that couldn't access the hospitals because they were fearful or because that they were closed to certain kinds of patients, whether that was really skilling up their peer workers in order to be able to do online peer-to-peer consultations or reviews. There's so much innovation that happened so quickly. And a lot of that was led by community organizations in those countries. And I think that's really something that we can be proud of. And I think when we start talking about building back better after COVID, it's really essential that governments look to hepatitis community organizations to help serve the needs that they're going to have with COVID. Because like we've been talking about, a lot of the populations that are disproportionately affected by viral hepatitis are also the ones disproportionately affected by COVID-19. And we know through a survey that was done by the UHC 2030 Consortium, which asked member states how they were using civil society in the COVID-19 crisis, none of the respondent countries said that they were actually using their community organizations to respond to COVID-19. So I think this is really something that we need to make the case for the value of community organizations to provide the response, and for policymakers to look beyond their healthcare systems if they really want to serve the needs of communities. I'll leave it there for now. Thanks.
Yeah, okay. Thanks, Gary. Let me turn it over to Wendy. I discussed sort of at a high level some of the impacts on patient care. Just wanted to hear from Wendy some of your own personal experiences of how your own practice has been affected and some of the strategies that you have put in place perhaps to overcome these barriers that I highlighted in my presentation, please.
So thanks very much. So we were very fortunate that we could actually continue our liver clinics throughout the COVID, although most of us were redeployed to work in the general medicine wards as well. And I think what we had to do is really reduce the numbers by about 50%. But what we ensured was that we actually really concentrated on patients with hepatitis B, hepatitis C who were on treatment, that they still came to clinics. And in terms of patients decompensated liver disease, that they still had access to the clinics. We had a very good system where our clerical system actually know the patients very well, knew the patients that actually didn't turn up, and made contact with them to ensure that they had enough drug delivery. And we were fortunate that in South Africa, they actually made the prescriptions valid for a year. So there was no reason why somebody should run out of medication. One had to actually notify patients of that, importantly ensure that the clinical services at the primary healthcare were aware of that ability. But I think, and then there was this really upscaling of home deliveries and access of drugs at homes or at clinics near them, and even at private pharmacies were providing the medication. So I think we managed to ensure delivery of medications, delivery of care to patients were still in the system. One of the problems is that we saw a rapid decline in referrals for hepatitis B and C. So in fact, for almost 3 months, we had no referrals. Our main referral basis is actually from the blood transfusion service. And for about 3 to 4 months, there were no referrals. And that's now fortunately increasing. But I think there's a lot to learn from our response to COVID, how we can take this further, particularly the community healthcare workers. We were really integral in actually testing patients, screening them, tracing, contact tracing. And I think the knowledge about viral infections has increased, both in the community and in clinicians. And I think we need to work on that in terms of education and harnessing that knowledge that's been gained.
Mm-hmm. Very good, thank you. And Arafat, I just had a question for you. Thank you for your presentation. Very, really found it very informative. How has the situation around COVID-19 changed in Uganda? Has it gotten better? Has it gotten worse? And in response, how has your work at the community level changed over time? Hopefully we have not lost Arafat. Let's see if we can get him back. In the meantime, we had a question regarding, why is it that the world can respond so quickly to a new viral infection like SARS-CoV-2, but yet it lags behind in utilizing proven interventions such as Hep B vaccination for birth dose delivery. I'm sure we all have thoughts about that, so we can go around the horn. So, Savanthi, what do you think?
Yeah, a very good question. I mean, I think there's many reasons, including political will, but I think maybe more nuance is probably that we don't see the effects till later down the line. There's that delay between vaccination and death. And so people don't equate it because it's decades often before there's death or HCC due to it. So it's probably that which doesn't stick in people's minds. With COVID, we're seeing the mortality, and of course it's a really important public health problem. I think that's one of the drivers, but there's many more.
Carrie, your thoughts?
Yeah, I totally agree with that. And I think also, like they were talking about a little bit in the last session, I think the link between viral hepatitis and liver cancer is not really well understood or expressed on any levels. So there's a real lack of being able to connect the two things between chronic hepatitis and this one of the top 5 cancers in the world. And I think generally it's exactly what we were talking about, was there's a kind of a lack of empathy for hepatitis patients in general. I think, it takes more than an investment case and just showing the numbers to get decision makers to take something and from their desk and put it into the finance, underneath the finance minister's nose to get them to pay for it. They have to actually care about that cause. And I think as a global hepatitis community, we can do a lot more about telling the stories of patients, elevating the voice of people living with viral hepatitis, and really portraying this as an equity issue, as a human rights issue, and not just about the eradication of a disease. And I think the more that we can humanize our cause, the more that we can make this a wider issue than just disease eradication, the more traction that we'll be able to get. Because in my experience, when decision makers say that they don't have the money, sometimes they don't have the money, but a lot of times it's some other reason why they don't want to do it, whether they don't sympathize with the cause, or they have some other project that they'd rather do. So I think you have to win hearts as well as minds in this fight. Thank you.
Mm-hmm. Yeah. Yeah, and I think that social justice objective and health and disease elimination are not in conflict. I mean, the ultimate objective of disease elimination is health equity, that everyone benefits from a intervention. So I think it's just how you message that to get the response you need.
Exactly.
Totally agree with that. Wendy, any thoughts about?
Yeah, I mean, I think the knowledge around viral hepatitis, both in the medical fraternity and the community, certainly in South Africa, is still very limited. And I think what we should be looking at, I mean, people are aware of this unseen virus that can cause havoc. Everybody wants a vaccine for COVID. And I think that study that you showed, the modeling where for every COVID death, if you implement the EPI, you can actually save children. I think it was 8 children, prevent 82 deaths under the age of 5 years. And I think one needs to really put across the point that we have a very effective hepatitis B vaccine that can actually prevent chronic liver disease, but actually can prevent cancer. I don't think people understand it. I don't think doctors understand it. And I think this is the time when we've got mobilization of communities, medical fraternity to actually educate and bring this knowledge to the fore.
Yeah, I always perhaps to a fault try to look at for positive aspects of the situation, and I know we have some definite setbacks, but I think that there's some opportunities here for us to as I was trying to lay out there, expanding access to care through the different options. I mean, for the very first time, telemedicine, where you can actually provide care for a patient over the computer, over a telephone, is getting reimbursed in the United States for the very first time ever, just because of COVID-19. So even in a developed setting like the U.S., new options are being created to expand access to clinicians, and so that can have. I'm sure there are other examples in other situations in other countries. Laboratory capacity improving, surveillance, contact tracing that can be applied. And I think it's all of us as community committed to this cause to raise those opportunities so that hepatitis is on the table when that new capacity is being applied to other diseases. We want hepatitis to be in that mix, and so I think that's really helpful. And can modeling help us with that, Shravante? Can we look at the different? Can we begin to look at different options for delivery of services? Do you think?
Definitely. I mean, I think modelling goes alongside what's happening in place. We need to understand how these systems can be integrated and what incremental impact it can have. But I think, integration is, the way forward, but there has to be space and political will to add hepatitis to another response, whether it's COVID or NCD. I think there's those things have to go in hand, but modelling can try and quantify it.
Yeah, absolutely. Yeah, I mean, I think your type of work is COVID is providing another opportunity to reveal the benefits of hepatitis prevention and care and treatment, and the consequences of losing that. So I think it's I'm sorry it's happening, but I'm glad that we have the data there to show people the consequences and why all of this is so valuable. Looking at vaccination, which is what you were looking at, brings to mind how we were on the cusp of Gavi providing support for the administration of Hep B vaccination at birth for the first time, particularly relevant for Gavi eligible countries in Africa. And unfortunately, they have put that on hold because of the response to COVID-19. So that's another sort of unfortunate, consequence that movement there was being interrupted. Hopefully, it's a delay and not a cessation. And so I think it will get back there, but it's good for us to keep an eye on that as well. And I think the other question was relevant to this is slowing down our progress. What can we be doing more to expedite our progress? So I think get our progress back, hopefully, to even a greater level. We've been touching on some of the benefits coming from the COVID-19 response. I don't know if anybody on the panel has any other thoughts about how we can begin to accelerate our services.
John?
Yes.
So I mean, one of the problems is always making the diagnosis and actually identifying the patients, individuals who are infected. And I think if we look at how we've been able to rapidly upscale the PCR testing for SARS-CoV-2, I mean, I think we should be looking at having this as a combined sort of platform of care. Now your HIV, hepatitis B, hepatitis C status, your COVID status. And if you think of the very easy screening tools that have been developed to identify individuals at risk of being positive for SARS-CoV-2, we should be able to really develop those easily implementable, risk factor screens. And I think we should take this as a positive and look how we can actually leverage on what we've gained in a sort of 6 months of, 6 months, we managed to actually address major problems in identifying, contact tracing, and I think we should really leverage this for viral hepatitis.
That's an excellent point. And indeed, on September 28th, we're going to have a side event at the United Nations General Assembly. It's going to be a webinar, since it's a virtual meeting of the UNGA, to actually delve into hepatitis testing and how it, and some of the possible opportunities coming from the COVID-19 response. So we'll be sharing information about how people can join that. We had Arafat for a moment. I was going to call on him, but unfortunately, I believe he might have had a transmission problem and has dropped off again. I do not see any other. There he is. Arafat, can you hear me, please? Please, you're on mute. Please take yourself off mute.
Yes, how are you?
I'm doing very well. It's good to see you.
Oh yes, it's very good to also see you, because I had to get into my phone and then try my phone, but otherwise I've left the laptop.
No, we're happy to have you back.
I'm equally delighted to be back.
Very good. So we've been talking about what are some of the positive opportunities coming from the COVID-19 response, in terms of, we've been talking about changes in how clinical care is delivered, or how improved opportunities for testing, because more investment in that, and improvement in just public health staff. And so just from your vantage point in Uganda, do any positive outcomes or opportunities come to mind for you in your work, either in your hospital or as a civil society organization?
Okay, thank you very much. I think from that point of view is that COVID-19, as the pandemic, has been able to give us an opportunity as civil society organization to be able to, one, identify the underlying problems and challenges which we face through. Number two is that it has been able to promote teamwork at workplace. Like for instance, at Bwero Hospital, we have been able to work with the peer groups, where we are able to profile the clients who need refills. And definitely under the COVID-19 lockdown, we have been having challenges of the public transport system, which has been completely been put off. But what we did as a team here at Bwero Hospital and Great Lakes Peace Center, we were able to work with the team of the people suffering from viral hepatitis B, and they are able to identify those who stay very far. As you are acutely aware, I stay in a mountainous area of Rwenzori, and this would mean that we are able to walk on foot to go and see the patients in there. But also importantly, we are able to talk with the political class to definitely bring them in, to bring the political commitment and leadership, so as we are able to help the people living viral hepatitis. The other thing which we definitely cripple with is the challenge of how are we able to reach out to the patients who are in distant places. The other important thing is that we have made a document which relies on 5 principles. Number one is to bring the political commitment and leadership. Number two, how do we able to screen mothers, to integrate the screening of antenatal cares through prevention of mother-child transmission into our clinics. The other thing is that how do we put pressure through civil society organization and other arrangement to ensure that we have the birth dose coming. And then how do we integrate the system of the COLDA system, where we get the vaccines from the central government, we get it up and we ensure that it's put under cold chain to reach the mountainous areas where we are not able to reach. Finally, is to encourage the mothers to deliver from the health facilities, because you are acutely aware that most of the birth in Africa take place outside the health facilities. So these are some of the issues we have been trying to re-echo to the responsible stakeholders in our communities, so that some of these issues are brought to their table, and moving forward, we can be able to eliminate viral hepatitis B, just as we are having 10 years to the elimination. I thank you.
Thank you very much. It's a great overview. Really appreciate it. Thank you all the panelists for a great discussion, and look forward to continuing to work on this together and really seize on some of these opportunities from COVID-19 to help our work toward hepatitis elimination. Thank you again. I'll turn it over to Mark and Manal.